All right, we're going to talk now about the top 10 symptoms of chronic Lyme disease. In the last video, we talked about acute Lyme disease. So this is chronic Lyme disease. So fatigue. What would you say that there's, we talked about fatigue in the last video about acute, but there's a different quality to the fatigue here. And my sense of it, I call it unrelenting and progressive. So, in the first acute Lyme disease, you're tired, but this is chronic. It's unrelenting. It's pervasive and life altering.
It doesn't matter how much you rest, you don't feel refreshed, or that restorative feeling when you take a nap or when you wake up in the morning. A lot of mornings you actually feel worse than when you went to bed.
Yeah, that's a very common thing for people to say. I wake up feeling like I was hit by a truck. Yeah, and then the joint pain. We talked about joint pain before, but this is a different quality of joint pain. And it can be Lyme arthritis, which is actually Lyme in the joint, but that's actually not that common in my experience. My experience is that people have roving joint pains. So one day the elbow hurts so bad you can barely move it. A day or two later, that's not so bad, but now my knee is so bad I can't walk on it. And if it was orthopedic, right, if it was or rheumatologic, that inflammation isn't just going to pop up and be on fire and then go away. But there's a neurological quality to this roving joint pain, in my opinion. So the joint pain is different.
And then there's also muscle pain.
Yeah.
And it has the same qualities where it moves around. Like maybe one day it's your shoulders, the next day it's your lower back, your feet.
Yeah. And another interesting thing is when you get out of bed in the morning and you put your feet on the ground, it's like, oh, my feet hurt. And so it very closely mimics plantar fasciitis, which is the plantar is the bottom of your foot, and fascia is the fascia of the bottom of the foot. Itis means inflammation. So plantar fasciitis usually is really bad when you wake up, and it gets better during the day. Lyme foot pain is described very much like plantar fasciitis, but it doesn't get better. It's bad all the time. Like you see these people hobbling around like, they've got, I don't know.
Because of their foot pain.
Yeah, their foot pain. They got like spikes in their shoes or something. It can be very, very unpleasant.
Yeah, and a big symptom for me was palpitations, cardiac symptoms. That is where I did probably the most testing from my primary care provider, was ruling out these issues with my heart, and then mixed in with the fatigue. When you're having palpitations all day long, you also feel more fatigued as well.
Yeah.
So those cardiac symptoms are another sign.
Yep. Lyme carditis. If you actually get Lyme in the heart muscle, it can be extremely serious and can cause sometimes fatal arrhythmias. It can certainly cause weakness of the heart, which can manifest as congestive heart failure sometimes. But blocks, heart rhythm blocks, up to and including a 3rd degree block, but usually a 2nd degree block, can occur, and it can be very serious. And we've had patients come here with pacemakers, and then we treat them for Lyme. And the cardiologist says, well, you've got this serious heart block, and you're going to need a pacemaker for the rest of your life. And then we treat them for Lyme, and they interrogate the pacemaker, and, in a couple of years of it being 100% normal, the cardiologist says, yeah, I guess you don't need that anymore. I don't know. I guess sometimes it just goes away. The other thing, lucky you, neurological symptoms. Did you have any of those?
I did have neurological symptoms. Brain fog was a huge one. I also had neuropathy, like in my hands and my feet. And just like this feeling of being almost in the twilight zone. It's really hard to explain that symptom. I was diagnosed with like silent migraines. They thought maybe that these weird symptoms were because I was having migraines without pain. Because I also had like different, light sensitivity and auras that I could see.
Yeah. So what's brain fog? How did that manifest for you?
Like swimming in pea soup. I don't know. It's just a cloudiness that comes over to you. that's really hard to explain, but that's the best that I could explain it. Was just kind of like everything was a little bit fuzzy, almost like when you get woke, like let's say you fall asleep at like 3 p.m. and you sleep really hard and you get woken up and you're just like, oh, where am I? Or, what am I doing? What day of the week it is, things like that.
One patient described it to me like she was laying underwater and she could see, but it was really a little bit distorted and a little bit weird and kind of removed. Or another person described it as, I feel like I'm living my life behind a sheet of glass. I'm just removed from life. I just don't feel like I'm there, but I don't feel like I'm a part of it. Is that, not having had it, I can only tell you what people have told me. But yeah.
I would say that's an accurate
How was your sleep when you had Lyme?
I would wake up a lot at night. I never really had an issue falling asleep, but I would wake up wide awake 2-3 a.m. It wasn't uncommon for me to be up at 2-3 a.m. for the day. And then, of course, during the day, it was just the fatigue that would come with not being able to sleep well. And the nights that I did sleep, I didn't get, like I said, that restorative feeling when I would wake up in the morning.
Yeah, and I would say
almost like being hungover every day.
Yeah, and that sleep-deprived fatigue is on top of that sort of unrelenting fatigue. I mean, there's two different things happening there that are stacking on top of each other, I would say. Do you agree with that? Yeah. And then, most people will say they can't fall asleep, and then they're up every 2 hours all night long, and sometimes they're up, like she said, at 3 a.m. The interesting,
wide awake.
Yep. And the interesting thing is that fighting this battle day in and day out often causes adrenal dysfunction. And it's very common for people to be up at 2-3 o'clock in the morning because of adrenal dysfunction.
And then the anxiety would come with it too when you're up at 2-3 a.m. Like you'd wake up with that like rush of anxiety.
Right. And that's also an autonomic dysfunction. Being in fight or flight results in some anxiety. And then mood. Mood disturbances is another one of the top 10 common symptoms of chronic Lyme disease. Did you have much in the way of mood disturbances?
I did. And you know what came first, the chicken or the egg, is the mood disturbances. Some of it was probably just my own frustration of being where I was at. And some of it was real. Like there was definite hormone disruption going on.